More Americans are using Medicaid during this public health crisis. The most recent federal numbers show 74 million people are enrolled in Medicaid. Nearly 10 million new enrollees signed up during the pandemic. Many of them said they lost their health insurance because of layoffs. Under the CARES Act, the federal government and insurance groups will pay for testing and vaccinations, but not all hospital stays are covered, according to a nonprofit group called Fair Health. Some Americans are paying up to $78,000 for care. Under a new law that took effect this year, hospitals are required to disclose this information ahead of time. Tonight, I'm joined by Julie Appleby. She's a senior correspondent for Kaiser Health News. Thank you for your time, Julie.
Thanks for having me.
So this hospital price transparency rule requires staff to post a range of actual costs online. Are all hospitals doing this, and what's the punishment for failing to comply?
Actually, no, they are not all doing it. Right now, there's probably 30 or 40%. It's hard to know who have not posted anything. And remember, this is a law that went into effect in the beginning of this year that does require them to post all of their prices that they've negotiated with insurers and their cash-only price for people who are uninsured on their website, along with a bundled list of 300 shoppable services. So like if you're having a baby or you have a hip replacement, you can look it up by that to try to get an idea of how much it might cost you.
So a health tracking poll shows only 9% of Americans know about this rule and 85% aren't researching this information. So the question is, does this rule benefit the consumer, or is it being followed because enough people don't know?
You know, it's a combination of those things. People don't know about it, and it's also difficult to research this. So yes, some hospitals have not posted this, but some of them have. But you got to know where to find it. It's often buried on their website. It can be a little difficult to find, and when you do find it, it's often an Excel file with thousands of prices on it, so it can be a little difficult to use for consumers. But I think what we're seeing now and what we will see are these private groups that are sort of aggregating this information and putting it out there in a little bit more understandable format for people to start using. So the idea is that people will eventually use this to shop around a little bit for care. And when they do, they're going to find that prices can vary a lot, even within the same region for the same services.
New protections are being enacted to prevent surprise medical bills. That's a good thing. Walk us through some of these rules.
Okay, so these are the bills you get when you go to an out-of-network facility, or you're in one of your in-network hospitals and you're seen by a physician or another clinician who's not in your network, and you have to pay the difference between what your insurer pays and what that hospital charges. So starting January 1st, that will not be allowed anymore in many situations, like emergencies or in air ambulance transportation, or when you're in the hospital and somebody is not in your network. They will not be able to charge you that difference. You will only pay what you would pay if you were in network, your copay and your deductible. In addition, if you want to see a doctor who's out of your network, they have to give you a written estimate of how much that might cost, and you have to agree to it ahead of time. So these are all new rules that are going into effect starting in January. They were passed under the Trump administration, and the Biden administration has just come out with the first set of what they intend to do to implement this new law.
Julie, do these new provisions benefit people who are both insured as well as the uninsured?
Yeah, in theory they do, because if you get one of these out-of-network bills, you'll be protected starting January 1st. And if you get one now, you can try to go online and find out what the prices are that you might want to pay or that they might be charging in that area. And there's a chance you could negotiate to get that rate, perhaps the self-pay rate, perhaps the rate that the insurers are paying in that area. And you can try to negotiate with the hospital in that situation.
Julie Appleby, very important information. Thank you so much for your time.
Thank you for having me.